Terry. Good morning, everyone, and Happy New Year. When Terry and I first spoke about setting up this webinar, I think it was probably 6 months ago. So time has flown by, and we're here at now in January 2018, and I've got a lot of great information to share with you today. As Terry mentioned, I'm Jim Martin. I'm Director of Policy and Programs with the Tobacco Prevention and Control Branch within the Division of Public Health, and I've been working in this field at the state level now and tobacco prevention and control for about 25 years. We have a new day upon us at this point in time with a lot of new and emerging tobacco products. And many of my colleagues have shared that the new landscape is really like the Wild Wild West right now. And so we're going to dig into that today in our webinar and really try to specifically look at a lot of the new products, the health risk of those products. We'll look at a lot of the policy-related aspects to regulating those products as well. So let's go ahead and get started. Let me just say that here's the more detailed information that I will cover today during this webinar. I'll start out by talking about the toll of tobacco use as a few key points and reminders, and specifically talk about findings from recent Surgeon General's report on smoking and health. We'll talk about some of the policy successes in North Carolina, especially those that have occurred over the last 5 to 10 years. And then we'll jump into trends in tobacco use among youth and look at survey data there from a state perspective. And we'll talk a little bit about what's happening in some of the recent national surveys that we've seen as well. Then we'll really look at, as I mentioned, the landscape of tobacco products today and the products that are on the market and that are especially appealing to youth. We'll talk about little cigars and cigarillos and share with you the differences between those products and actually cigarettes as a combustible tobacco product. And then we'll talk about hookah, and as well as I'll spend the most of the time when we're talking about the new landscape, I'll spend most of the time today talking about e-cigarettes. And then building off of e-cigarettes, the 2016 report of the Surgeon General was focused on e-cigarettes, and so I'm going to cover the key findings from that report, and then talk about a number of public health concerns we have in regard, especially in regard to e-cigarette use among youth. And then we'll move into how these products are currently being regulated. Specifically, we'll talk more about the changes related to policy change on e-cigarettes, not only at the federal level, but what's happening at the state level as well as the local level. And then I'll share with you some national as well as state resources with you today, and then we'll have hopefully ample time for questions and answers. So let's move forward in talking specifically about the toll of tobacco use. I'd like to start with this slide that specifically points out that we just had a landmark report just a few years ago in 2014 that was the 50-year anniversary from the first Surgeon General's report on smoking and health that was the landmark report of 1964. And as you all know, that report was the first Surgeon General's report to specifically have smoking as a causal effect for lung cancer. And then we jump forward 50 years to the 2014 report, and we're still actually have new findings as regard to specifically smoking and combustible tobacco use as it relates to disease. And let me cover a few of those points. But before I get to that, looking at the trend line of what's happened over the last basically century, you can see what the escalation of smoking in the U.S. Leading up to the first Surgeon General's report in 1964. And then you begin to see things that are happening from a public health perspective, from a policy perspective, that have sent tobacco use, especially consumption, in a downward trend, which is a fantastic public health success story. But we still have a long way to go. And that's, I think, the point of today, that we've made a lot of progress, but we have a long way to go, and that we have a new landscape that we're also dealing with new nicotine delivery products. So during the time between 1964 and 2014, the Surgeon General's report estimated that we've actually lost over 20 million people because of smoking. And many of those deaths, as you know, are premature deaths. 2.5 million non-smokers estimated have also died as it relates to secondhand smoke, and more than 100,000 babies. Smoking, even with the progress that we've made, and you just saw that in the graph, even with that progress, smoking is still the leading cause of preventable disease and death in the United States. Again, smoking, as you can tell, as you know, causes a tremendous toll on the body and leads to many chronic diseases, as you can see listed in bullet 2, and you're very familiar with these. One point that the Surgeon General's report of 2014 points out that for every person who dies from a smoking-related disease, there are actually 30 more people who suffer with at least one serious illness from smoking, which obviously leads to loss in quality of life and leads to huge healthcare costs. So this is actually a graphic from the 2014 Surgeon General's report, and you can see that the number of cancers has really grown over the years, starting out from 1964 with a link between smoking and lung cancer. But now you can see the list of cancers, and these are cancers that have been directly seen as smoking as a cause. It's a causal effect for these types of cancers. The ones in red on the side, liver cancer and colorectal cancer, were added to the list in 2014 as a causal. There had been inferences of data and concluding data in the past from studies that linked smoking to those specific cancers, but there was enough evidence for this report to show that there is a causal effect. So you can see unfortunately, the long list of cancers. And then on the other side, the long laundry list of chronic diseases that are caused by smoking. And you can see the ones in red, again, were ones where we have enough scientific information to be scientifically clear that there is a causal effect from smoking as it relates to these diseases. I think Dr. Davis at Duke University describes it well in that combustible smoking or using a combustible tobacco product, once the chemicals from those products invade the body, they basically touch in a negative way in every cell in the body, and it obviously has negative effects on specifically related to cancers and chronic diseases. There were also key findings in the 2014 Surgeon General's report in regard to secondhand smoke. Estimated that, again, the number of chemicals documented are over 7,000 in secondhand smoke, and we also know that at least 70 of those chemicals have been known to cause cancer in the human body. And then children exposed to secondhand smoke also have increased risk of acute respiratory infection, ear infections, and asthma. This is another graphic from the 2014 report, just to give a visual for the effects on children and also the negative health effects for adults. And as you can see that stroke was added to the list in 2014. Again, smoking is a causal effect for stroke. A previous report going back to 1996 from the Surgeon General pointed out that there's no safe level of exposure to secondhand smoke, which was re-emphasized in the 2014 report. So in regard to policies that have been put in place to protect especially non-tobacco users from the exposure to specifically secondhand smoke, and also to have a supportive environment that is completely tobacco-free. I'm going to cover some of the policy changes that have occurred in our state in the last decade. Starting out first with the smoke-free restaurant and bar law that was passed by our General Assembly in 2009 that went into effect in 2010. This has been a huge public health success for North Carolina, and as you can see in this map, we really stand out among the southern states. We're the only state with a comprehensive statewide law that covers all bars and restaurants and prohibits smoking at all times. Some of the stars that you see in some of the other southern states are specifically designated municipalities or counties where there have been local city or town or county ordinances that have passed. Therefore, if you're in some of those states, you may be still walking into one community where you go into a restaurant and you're asked if you want to be seated in a non-smoking or smoking section in comparison to our state, which covers the level playing field. All restaurants are covered and all bars are covered within the state. This has, again, had a really positive impact on our state, especially for those workers who were exposed to secondhand smoke on a daily basis, as well as children being exposed in many of those settings as customers. And it's, again, made a cleaner, much cleaner environment. It's had a major impact on both short-term or specifically in looking at reducing, in one of our studies, in reducing emergency visits as it relates to heart attack, because we also know that even brief exposure to secondhand smoke for those individuals who have cardiovascular risk factors can easily cause the blood platelets to clot more easily and can cause a heart attack. So even in the first year, we saw a major reduction in the average weekly emergency room visits because of heart attacks. Other venues or places and environments that have adopted tobacco-free policies include the following. All of our hospitals, and we're proud to say that all 127 of our acute care hospitals in North Carolina have all adopted tobacco-free policies for their entire campus. And more recently, the state-operated healthcare facilities in North Carolina, all 14 of them, the mental health hospitals, the developmental disability centers, the alcohol drug treatment centers are all 100% tobacco-free as of July 2015. And this was, again, a huge success story for North Carolina in really treating nicotine use as an addiction and looking at a recovery model in these centers across the state, focusing on, again, a much more safe and healthy environment and a focus on, again, on treatment and nicotine replacement therapy has been greatly enhanced and increased in those centers since that policy went into effect. This has been a real win-win for the centers as well as the clients who are in those centers. By state law, all of our prisons are tobacco-free inside as well as on the grounds. I'll start at the bottom on the next column. More recently, our child care centers across the state, the Child Care Commission passed new rules this summer that makes all of the child care centers, all of their property tobacco-free. for all products, including e-cigarettes. As of 2008, all of our schools across the state, all 115 schools, 15 school districts have adopted a tobacco-free policy campus-wide. For our community colleges and private independent colleges, we have made great progress. All of those colleges and community colleges have the clear authority for their boards of trustees to pass policies for their campus, and thus far we are at 42 out of the 58 community colleges that have adopted policies that prohibit smoking and tobacco use on all of their campuses. And we have also 15 out of 36 independent colleges that have adopted campus-wide tobacco-free policies. And we've seen a growing trend in that movement, not only in North Carolina, which is really leading the country with our community college effort, but also with colleges across the country going tobacco-free on their campuses. With our UNC system, there's state law that actually only allows the campuses to prohibit smoking on their campuses, on their grounds, within 100 linear feet from the building, except for the medical schools and facilities at UNC Chapel Hill and also at East Carolina University. So those medical campuses have also adopted a tobacco-free policy for that aspect of that portion of the campus. But again, our campuses have only been able to go up to 100 linear feet, which is the majority of them have moved in that direction. But these are perimeter policies, which are also many times challenging to really clearly communicate and clearly enforce. We've also had a major media campaign over the past year. Unfortunately, the funding for these types of campaigns in North Carolina, at least the state-supported campaigns, have been cut through the budgets. However, the CDC has been running ads from tips from former smokers, real people, real stories, and you'll see that Terry's story. Many of you may know Terry Hall or knew her. She was from the Forsyth County area of our state, and did just an incredible job to tell her story, not only visiting schools around the state, but also the ads that she conducted here, as well as the national ads that she conducted. I think had a great impact on many, many people from hearing her story and understanding the deadly effects of what smoking can do to you. Unfortunately, we lost Terry a few years ago to cancer, but her legacy lives on in all of us. We also have a very effective quit line here in North Carolina that can be utilized free by individuals calling in to the 1-800-QUIT-NOW number. You can see that the program is supported not only at the federal level, but also by state funding to be able to offer 4 treatment sessions, also special treatment sessions for a protocol for pregnant women. These are highly trained professional quit coaches that are available, again, 24 hours, 7 days a week, can utilize many languages, and can be integrated within an interactive web-based tobacco treatment program as well. So we really rely on our quit line quite significantly. Hospitals rely on this. Physicians' offices rely on this quit line quite significantly, in that they're having their patients call the quit line to get this professional assistance over, again, treatment sessions. And when we have the funding, we can also offer nicotine replacement therapy through the quit line, also on a limited basis, especially for those who do not have access to health insurance. Medicaid also has ability to fund and support nicotine replacement therapy. So moving on to looking at our trend line, and specifically related to youth, and this data looks at smoking and cigarette use among our high school students as well as our middle school students since 1999 to our the latest data that we have is 2015. This comes from our youth tobacco survey that we conduct every other year. And we're just concluded this fall with conducting the 2017 survey. So that will be analyzed in the next few months, and we'll release that data in the spring. But looking at the trend line, you can see the progress that North Carolina has made. And again, this is a huge success that we should all applaud. And there's been many factors that have contributed to the reduction in tobacco use among, specifically smoking among our high school students and our middle school students. Looking back at 1999, if you actually went back further than that, the trend line was actually increasing. So at 31.6, we were at one of the highest historical levels we had ever had among high school students, and at 15%, again, one of the highest levels that we had ever seen among middle school students. But again, over time, with an investment of funding, with investment of champions at the state and local level, with active youth involvement, with policy change, with media, with education, again, with multiple partners being involved in this effort, we have really significantly reduced smoking among high school, middle school students to the lowest levels that we've seen historically, at 9.3% among high school students and 2.3% among middle school students. I shared most recently with a legislative committee that if you look at the number of students that adds up to in a reduction of youth that are smoking now that were smoking in 1999 in comparison to 2015, it adds up to approximately 70,000 students, a reduction of that number of students that are actually current smokers. And I also shared with them, to get some context of that, if you loaded school buses with students from middle and high school, and you pulled up a bus and filled that bus to capacity, and then moved that bus forward and created a convoy of school buses, that the school bus convoy would actually add up to 10 miles of school buses back to back. So it gives you some perspective on the prevention efforts that have been put into place that have led to these reductions in a significant number of students now that are not using that are not smoking cigarettes. Unfortunately, we have to turn the page and see what's happening in the context of other tobacco product use among our high school and middle schools. And specifically, if you look at high school students here, this is our Youth Tobacco Survey 2015, and this gives the prevalence rate of any of these tobacco products being used by students. This is a marker of current use, which means that they identified that they've used one or more of these products in the last 30 days. You can see that I mentioned cigarettes at 9.3, historical low there, but unfortunately what we've seen is a huge spike in e-cigarette use that has gone from, in 2011, as these products were hitting the market, we had 1.7% of our high school students identified that they'd used the product in the last 30 days, used an e-cigarette product. This jumped up to 16.8% in 2015, which was very closely mirrored what was happening nationally as well. We've seen almost a 900% increase in e-cigarette use over just a short time frame. We've also seen increases even though there have been smaller increases with cigars and flavored little cigars, as well as we've a little bit of an increase with hookah and water pipe as well, but mostly what we're seeing that, and I'll cover that more in depth shortly, we're seeing more use of that in the college population, which we may see filter down to our high school students as well. So if you look at overall middle school and high school tobacco use, which means that a student identifying if they're using any of those types of tobacco products that were just identified in the previous slide, then we've seen a backward slide. We've seen, again, from 1999, a nice downward trend, and then with the emergence of new tobacco products, especially e-cigarettes, coming in between 2009 and 2011, we see that there's an increase of the overall tobacco use going back up, and this is going obviously in the wrong direction to lead us toward success with our healthy people and also a healthy North Carolina 2020 objectives. So moving from 25.8% in 2011 among high school students to 9.9% among middle school students, and then going back up to, again, going back up to 29 and then leveling off at 27, which was really not a significant difference between those 2 years. And again, upward trend among our middle school students in overall tobacco use. So now we're going to cover this whole new changing landscape of tobacco products and talk about some of the themes and the health risk of these products. So I'm going to start with little cigars and cigarillos. These have been very popular, and I didn't break the data out previously in the previous slides just based on time, but we've seen a much higher increase with these products among African American youth, which again leads to, and really is because of the heavy marketing of these products to this population. So here's a illustration of what we're talking about when we identify cigars and cigarillos and little cigars. And many of you, especially looking at a cigarette on the graphic as well as a little cigar, probably would have a challenging time identifying the difference between the two because of the similarities in the way that they look and appear. They both seem to have constructed in the same way. However, the only difference between the little cigar and the cigarette is actually the rolling paper, and that a cigar is defined in federal law and then also state law as any roll of tobacco wrapped in a tobacco leaf. And so the little cigar is actually manufactured with not a specific paper that's used for cigarettes, but it is actually wrapped in a tobacco leaf. Because of the definition and the way it's constructed, it falls into a different category and it's taxed differently. It's much lower on the spectrum for being taxed, not only at the state level but the federal level. The cigarillos you see there, again, wrapped in a tobacco leaf, just a smaller version of the cigar. The little cigars and cigarillos, again, are available in a wide variety of flavors. I think you're going to hear that as a theme as I cover these products, looking at cigars and cigarillos, hookah, and e-cigarettes. They're actually sold in smaller packages, less expensive, and come in a variety of brands. Black and Mild is one of the brands that's most advertised, I should say. Again, you'll see the marketing themes here that really attract youth to these products. You can see that here you can buy 2 for 99 cents in comparison to cigarettes, which would be buying a pack of 20, which they're all standardized in that, and would be paying over $5 per pack for that. So these are attractive especially for youth. So there's a lot of misperceptions that actually cigars are smoker or they're safer, and I'm sure that many of you have heard this over the past years. However, that's not true. That's a totally misperception. That you have more tobacco, more nicotine than cigarettes, enough to cause and sustain addictions, very clearly been pointed out in studies. There are actually longer smoking times than cigarettes, and in comparison, higher levels of cancer-causing agents, more tar, higher concentrations of toxins, especially carbon monoxide and hydrocarbons and heavy metals. So again, this can lead to cancers, many of the ones that we talked about earlier on the illustration, coronary heart disease and lung cancer. So we do not see a safer product on the market from cigars or little cigars. The chemical toxins can be also absorbed regardless if the person is actually inhaling the product through the lips and tongue, the mouth, throat, and larynx. Also swallowing the exposure of the chemicals through the saliva also provides toxins, can lead to esophageal cancer. So hookah is a product that we've heard about for centuries, water pipe use, but unfortunately has been more publicized and promoted in our country in the last few years, and has been specifically targeted a lot to college students. Here's the kind of the anatomy of a water pipe. You see that there's a head, there's a body, there's a bowl, hose, and the water piece. You can see over on the side that there's a graphic showing that there's a hot charcoal that can be put on over a aluminum foil, where you have the tobacco product that's put up in the head of the product. The tobacco product is referred to as a shisha, and is then heated and in many ways goes through an aerosol process where you can inhale on the hose and inhale an aerosol that contains the nicotine and other chemicals. Hookah tobacco, again, as I mentioned, known as shisha, comes in a variety of flavors, and you can see some of these flavors listed here, from Scooby Snack to Double Apple to all, to Gumball, all types of strikingly fresh, again, tobacco products that are really appealing to college students. The flavors also take away some of the harshness of the tobacco itself and provide more of a cool and a mild smoke as to the user. The content, unfortunately, from analysis from hookah cafe websites is that these products are often promoted as a safer product, again, than smoking cigarettes or using some type of other combustible tobacco product. There's one study concluded that there's 16% included direct statements indicating that hookah smoking was safer than cigarette smoking. 43% didn't mention the word tobacco at all, that you're getting exposed to any type of tobacco product, promoting that the flavors, pleasure, relaxation, the social aspects of this. And this is why it's become very appealing on college campuses, where you've seen a lot of hookah cafes, hookah establishments that have been established near college campuses. And again, 72% of the analysis of hookah cafe websites really promote all the flavors that you can come and enjoy. So again, looking at some misperceptions from some studies, here are some quotes from focus group studies showing that one participant said that hookah will never be addicting because it does not contain nicotine, which obviously that's not correct. Hookah is harmless because all the smoke passes through a water filter, so it just becomes water vapor. Obviously, this is not true. All we're inhaling is just the fruit flavors. And another person was saying that I hate smoking cigarettes because it has a bad, it has a bad taste and to it compared to hookah, which is very flavorful. So unfortunately, this misperception is leading people to think that it's a safer choice, but unfortunately getting many of the negative health effects as combustible tobacco products, other combustible, specifically cigarettes. The health risk, again, lung cancer, respiratory illness, low birth weight, again, similarities that you've seen with smoking from the other graphics. Again, continuing on, that hookah smoke contains very high levels of nicotine, carbon monoxide, carcinogens, hydrocarbons, heavy metals, and other fine particles. And I want to make a note down at the bottom in red that it's important to note that people may feel like, well, I only do this once a week or in social settings with my friends from college or high school friends that may enjoy it at one of our friend's homes, a teenager's home who has a water pipe. That unfortunately the hookah smokers inhale about 50 liters of smoke over only a 30 to 45 minute period, and which can actually add up to a user consuming 100 cigarettes during a single session. So again, in looking at that in perspective, obviously you can see that this can be misperceived as not having that much of an effect when in fact it's really having a pretty huge negative impact on the body. There's also been studies showing that hookah can also lead to infectious disease risk with sharing hoses. There was a reported outbreak, for example, in Denver, Colorado, that epidemiologists tracked back to the use of hookah. So now I'm going to focus the majority of my time on electronic cigarettes, which have been the new product on the market since about 2007, mainly with popularity growing by 2011, and really focus on these products and what they look like and the health effects and a lot of the specifically looking at policies to address these products. So electronic cigarettes, in the Surgeon General's report of 2014 and also from papers by CDC, they're often referred to they often refer to these products as electronic nicotine delivery systems, or ENDS, but I'm going to mostly refer to them as e-cigarettes in this webinar. So the introduction of e-cigarettes, again, in the U.S., really we began to see these products on the market in 2007. And initially, many of you may have seen these products being promoted in a mall setting, like a kiosk in the middle of the mall, where if you went up and actually spoke with the vendor, they would tell you that this is a really good product to help smokers quit, to transition to a product that's much safer, to be able to still get nicotine from the product, but is in a safer mechanism. And then in just a few years, you begin to see these products being promoted through tobacco retail outlets. Let me back up and just say that with those products being promoted on the market and those vendors that were beginning to promote these as a form of quitting cigarettes, the FDA actually stepped in because the way that the products were being marketed from ads and websites and also from vendor information is that they were being seen as a cessation device, in many ways being seen as an alternative medicine as a nicotine replacement therapy mechanism. The FDA really tried to take these products off the market based on how they were being marketed as a nicotine replacement product, and because all of those products that are approved by the FDA as nicotine replacement therapies have to go through the clinical trials and be approved by FDA. So FDA tried to take those off the market. That went to the court system, and eventually moving through the court system, the federal case was decided that these products could be regulated by FDA as a tobacco product. However, the companies could no longer also make the claim that these products were a cessation device or any kind of way or to allude that they were effective medicine. And so that was the court decision. I'll talk a little bit more in a while about how FDA is beginning to regulate e-cigarettes as a tobacco product. So the term e-cigarettes, there are many terms that are being used out there for these types of products, and I'll show you some illustrations of these products in the next few slides. But there are cigalites, there are e-cigars, there are actually e-pipes, e-hookah, vape pens, hookah pens, personal vaporizers, and also mods. And again, if you go back just a few years ago, a little over a decade ago, no one knew about these products at all, and now they've really hit the market and are especially attracting kids to their use. So the anatomy of an e-cigarette is basically made up of three major components, no matter what the design of looks like, and I'll show you some examples in a second. But basically made up of these three components. There's a liquid cartridge, which holds the liquid nicotine. The other chemicals that are normally in these products are propylene glycol and vegetable glycerin. And the products can either be a sealed cartridge or one that can be opened and nicotine solution can be added to it. The atomizer is actually a source of heating the liquid, and then you have a power source or a battery content. So the batteries, many of the batteries on the newer products can obviously be recharged through through normal mechanism, and so the basic components are these three, but they vary in the way that they appear. And here are examples of these products. Cigalite was the term often used for the first generation of e-cigarettes, which were disposables. And you see that the disposable, once the nicotine content was used up, then they were just thrown out. The next generation was the product Blue, and this is probably one you're very familiar with because it's been heavily advertised, which came with a rechargeable replacement cartridges. So these could be recharged, the battery life just in a USB port, and the box actually serves as a charging mechanism. So what the user would only replace is these replacement cartridges, which contain the nicotine, propylene glycol, vegetable glycerin, and also flavors. The third generation came along not shortly afterwards, which is, again, a new design. It looks very different, has the same components as I described earlier, but these can be recharged as well as refilled. They are often called the tank system product. And then also another generation, basically, that came along was taking the rechargeable tank systems and making them modifiable, and this became a slang term called mods. You can see here that the battery is much larger. The container for nicotine obviously can be replaced. It's much larger. It can be dialed in temperature-wise. Again, the battery life not only larger, but lasts a long time. A lot larger product that can deliver a much higher content of nicotine as well as aerosol to the user. And more recently, this is a new product that many of you may have not heard about just yet. but it is the most popular product among youth at this point in time. And this is a product that's manufactured here in the U.S. Through a new company in San Francisco, California, and the product looks very much like a flash drive, and it can be easily, again, easily disguised as a flash drive or a computer stick. And so it is, the product is called Juul, and it has been termed as the Apple of vaping by many teens. As every teen wants an Apple phone, many teens are being attracted to this product because of its sleek design. It's easy to conceal. It is now actually has the term that kids are using. Instead of saying they're using an e-cigarette product or they're vaping, the term now is juuling among our high school and middle school students. These products, they have, and you can easily charge them through a USB port. The top part, there is a top part of where you see where the forefinger, that upper part is called a pod. It slides off. It's a nicotine container. They come in 5 kid-friendly flavors, and you cannot replace the nicotine. It's not refillable. However, kids have posted YouTube videos where they've been able to get nicotine juice and actually refill them with a nicotine solution, even though they're not designed that way. But this is again a product that has become widespread popularity, and it has surpassed any of the other products that are being sold at the retail level by any of the big tobacco companies. If you look on the web, you can find all kinds of other designs that have been, again, associated with the 3 components of an e-cig product. These are mods. You can see an Altoids box down below, a Nintendo box that was actually created. All kinds of interesting and creative inventions here to use those 3 basic components as I described earlier to set up an electronic nicotine delivery device. There are also, as I mentioned earlier, hookah pins. Again, misperception that the way these products are being marketed, that they're much cooler and that they're better, the same way that the Juul is being promoted as cooler and better, high-tech. Again, it's the same product design, delivering the same product. It's just dressed up differently and appealing in many different ways. Here's a quote saying, we'll just be passing the e-hookah around and enjoying the smell that the flavor leaves in the air because it smells all fruity, candyish, and delicious. And the e-hookah just sounds like it's better because if you have an e-cig, it's still a cigarette in a way. And then if you have a hookah pen, it's like hookah. It's kind of cool and it's much better. So again, the way these things are being marketed they're deceiving youth that these are safer, they're cooler, they're just delivering water vapor, fruit flavors, and they're not getting any of the negative health effects. And unfortunately, that's not true. The liquid that I mentioned earlier that can be used in the refillable tank systems it's sold separately. You can buy this at at vape retail shops across the state. Usually the product varies. Often advertised as zero, sometimes a zero content of nicotine, up to 36 milligrams per milliliter of nicotine. Unfortunately, the zero can often be incorrect. Their FDA has tested bottles of e-liquids that say zero nicotine and found nicotine content in those products. So they're not regulated very strongly right now, and therefore the consumer may not know exactly how much content of nicotine they're getting in the product. I will mention that with the Juul, we're finding that the way that product has been designed, it is using nicotine salts, and which delivers a very high content of nicotine, actually 50 milligrams per milliliter of nicotine in the Juul product. However, with the nicotine salts, the salts for the chemistry of that really reduces the harshness of the nicotine itself and becomes more of again, a smoother and product that can be used, especially by our youth. So we're seeing very high content use among products like the Juul in comparison to just getting a product with a tank system where you buy nicotine separately and refill it. So we are concerned about that, especially for our youth population. I mentioned earlier the solvents that are in there, propylene glycol, vegetable glycerin, and then the flavors, which I'll talk about in just a second, as well as additive sugars and sweeteners, again, to make the product more appealing to the user. The flavors and brands have just really multiplied onto the market, again, in a very short period of time. There are now over 460 brands specifically, and over 7,000 flavors, unique flavors that are on the market today. And this is, I've heard estimates, this was a study that was conducted in 2014. I know that they're duplicating that study now, and I'm hearing that some of the preliminary results is there's well over 8,000 flavors now. I'll share with you that we recently sent a press release to our communications office at the department level for press release, and we identified in there that there were over 7,000 unique flavors that were being marketed, especially that are appealing to our youth. And let me just name a few of these flavors. There's, I mean, almost any flavor that you can come up with that's on the market, but here's a few examples of the flavors that are out there. Like you can see the cotton apple one, or candy apple. There's cotton candy, there's Smurf cake, there's cherry crush, banana split, Kool-Aid. That's just to name a few. But as I mentioned, that we mentioned in the press release over 7,000 flavors and gave some examples. And our press officers came back and said, I think you've got a typo in the press release when you said over 7,000 flavors. Do you mean over 70 or 700? So we had to actually go back and show the research study from 2014 that again identified the number of flavors. Now the flavors themselves, you may think, well, or could be harmless because we're used to flavors. We see them in our food all the time. We see them in beverages all the time. And the FDA has concluded that the flavors in those products are basically safe for the consumer. However, it's important to point out that that's flavors that are being digested through our foods and through liquids. And what we have here is flavors that are being inhaled. So these are potential effects of flavors on our respiratory system. So the data that you see here in front of you on the flavors is that one of the flavors that has been caused to show irreversible lung disease and as being inhaled is flavor that was first identified through a popcorn factory where there was buttery flavored popcorn, where the buttery flavor was being added to the popcorn, and workers were being exposed to that flavoring by inhaling the flavors and that were coming off the aerosol of that product. And so the chemical component within that buttery flavor was diacetyl. And that chemical specifically led to an irreversible lung irritation and disease among those workers, often termed popcorn lung. And as you can see in the visual there, the image, that the worker now using that as protected through this, you can see the respiratory mask there. They're required now to use that in the manufacturing so that they're not inhaling that flavor which contains diacetyl. And diacetyl has also been shown to be in multiple flavors that are being used through e-cigarette use. I'll talk a little bit more about flavors and some of the research that's going on at UNC at the School of Medicine through some of their research work in a few minutes. So nicotine delivery here on these products, again, nicotine is being delivered directly to the pulmonary system. It's a rapid absorption of nicotine into the system. Some of the newer products that I described earlier, which are larger and actually can be heated to a higher degree that contain nicotine, that actually contain more nicotine than conventional cigarettes. And it's hard to know how much the user is actually consuming of nicotine and how much they're getting into their system because of the way the products are designed, and specifically the looking at the voltage that I mentioned earlier, the battery life, or the size of the battery and the voltage that's coming off those products, the nicotine, the heating element, and the nicotine solution itself can all vary in these products. And also, of course, the behavior, the puffing behavior of the consumer or the individual. What about the volume, velocity, and intervals at which they are utilizing an e-cigarette product? Those are all various variables that can impact how much nicotine is being delivered to the system. It's often very difficult to, we've done this and researchers have done this with individuals through focus groups of e-cigarette users to really determine how much they're using the product. I mean, many of them have done daily diaries to try to identify that, but just to the average user, it's hard to identify. As compared to smoking, it's very easy to identify a pack of 20 and how many cigarettes, because the cigarette has a beginning and an end point, and you know the specific number, so you can identify about how much nicotine a user is getting if they're using cigarettes or some other combustible tobacco product. But with these e-cigarette products, you can utilize the product as long as you have battery life in solution. And so we've heard some researchers at Wake Forest University identify that consumers have to self-monitor themselves. Sometimes they feel they're getting a little nauseous or dizzy. So maybe they feel like they're getting a little too much nicotine within their system over a short period of time. But again, these can deliver very high volumes of aerosol to the system, which contains a large amount of solution of nicotine, and along with the other chemical components. So I've mentioned all along, I've called this an aerosol that e-cigarette users are inhaling, and it's an aerosol. Many people refer to it as a vapor, and the manufacturers also refer to it as a vapor, but it's not a vapor. We often can think of vapor as water vapor, and that it's something that would be safe. It's not a vapor, it's an aerosol. It contains chemicals. And so, again, let me go back one time. Again, because it contains chemicals, nicotine, propylene glycol, vegetable glycerin, the flavors, we've seen other metals, and I'll go into a little bit more in detail here. But again, I would suggest that you always refer to these as an aerosol and not refer to them as a vapor. And again, because of the misperception that they're harmless water vapor, and we hear this from youth all the time. They're just fruity water vapor products. But again, as I mentioned earlier, it can contain high contents of nicotine. Other toxins are found many of them at a little bit lower level than conventional cigarettes, but again, it depends on the size of the device that I mentioned earlier and the voltage. You have very fine and ultrafine chemicals in the aerosol, actually very similar to what's in cigarettes, and carcinogens have also been identified, especially within those products that can be heated to a higher level. We've seen formaldehyde there that's been identified. You know, propylene glycol is also used as a food solvent, but we've had, again, there's been studies showing that it can be a respiratory illness. And then heavy metals. The majority of the products, especially the tank system products and the ones that are being sold through vape shops, are mostly imported from China. We often see that they are made very inexpensively, and that small microscopic levels of heavy metals and metals can actually be consumed through the atomizer, the coil flaking off, or other content within the product. So the consumer may be getting heavy metals within their respiratory system without even realizing it. So let's talk a little bit about, again, the emissions from e-cigarettes. There's no side stream smoke coming off of these, or side stream aerosol, I should say, but there is mainstream. And if you've ever seen a user, you can see that they can exhale a really heavy amount of aerosol depending on the size of the device that they're using. This has actually become very popular among adults and youth, and actually has been turned into competitions about who can exhale the largest cloud. And so if you look on YouTube or Google cloud chasing, or you can find lots of videos and lots of illustrations of people consuming these products to try to exhale the largest cloud of aerosol. Unfortunately, what we're finding, though, is this secondhand aerosol can be just as badly for the non-user as for the user. The same holds true, as I mentioned earlier, for secondhand smoke. And therefore, we do not need people that are non-users being exposed to the contents here of nicotine, the ultrafine particles, propylene glycol, the artificial flavorings, and the heavy metals that can be exhaled by the user, that when inhaled by the non-user can have just the same types of respiratory effects and cardiovascular effects as has been identified with users. So we want to make sure that people are not being exposed to these chemicals in the workplace or in other public places. So as I mentioned earlier briefly, there's a lot of research going on right now across the country on the health effects of e-cigarettes, and we're in the early stages of this, as you might imagine, as you've seen from once these products came on the market. Just in comparison to that, looking at smoking and as I started off from the webinar, talking about 50 years of research from the 1964 report to present day, we're still seeing research studies pointing out the health effects of cigarettes. And so therefore, just in the early stages of identifying the health risk of using e-cigarette products, here's a quote by Dr. Flores Sassano, and she's at UNC School of Medicine, UNC School at Chapel Hill. And the research that they've shown is that, her quote is that when we expose human lung cells to e-liquids in either an e-liquid form or in an aerosol, we see cell death. And we see that cells get stressed because of the exposure to e-cigs. And these are definitely negative effects on the cells we study in the lab. So I'm going to show you a little bit of what they've done in the lab using these products. So here's of some of the methodology that Dr. Sassano is talking about. There are some of the results here, where they took lung cells and looked at exposure of them, looking at between 0 and 35 puffs of e-cigarette aerosol directly to the cells, and then the viability measured over a 24-hour period. So they bought e-liquids that were on the market, went to a local shop and bought these, and then brought them back and used a machinery to actually exhale the aerosol directly onto the lung cells to see what type of effect it would have. And here's data showing the effect. So you can see that up at these are cell screening data after flavored e-liquid aerosol exposure. It shows similar, what it shows here is a flavor-dependent, dose-dependent decreases in cell viability. So this is only 5 puffs. So these are cells being exposed to more than, or equal to or more than 5 puffs. And you can see that it goes from 0 up to 35. So you can see the control, 0 puffs. So you see it over a 24-hour period that the cells have strong viability. They're living strong. They haven't been exposed to any types of chemicals that can have a negative effect on the cell. And then you see basically what happens here is that over the different types of products and with different types of puffs being utilized, you can see that, again, the higher exposure of liquid aerosol to the cells causes lung death, as Dr. Sassano said in her quote. So you can see this how it's illustrated. So you go from 1 to 5 to 15 to 25 to 35 puffs, and you can see the different types of flavors. This is 70% propylene glycol, 30% vegetable glycerin. In the first one, that was just the vehicle. There was no other chemical components and no other nicotine. And then you have a different percentage of just the propylene glycol and vegetable glycerin, and then you add in the peanut butter cookie flavor, banana pudding flavor, and then the hot cinnamon flavor. And you can see in all of these that they all had negative effects on the cell viability, but some of them were worse than others, especially when you get out to the hot cinnamon. And so some of these flavors, again, can have more negative effects than other flavors on the market. So the research really concludes that if you've tested one flavor, you basically tested one flavor as far as the health risk. And so it's important to know that we've never had people inhaling flavors like this before. And so I think we're going to be able to see from this early on research that we're going to unfortunately see negative health effects coming as a result of inhaling these products. Here you see also a study where you looked at increasing e-liquid, just the device power increases the amount of aerosol produced in each puff, which speeds up the negative effects of the propylene glycol and vegetable glycerin aerosol. So again, in the 0 puffs was control, then 1 puff, 5, 15, 25, and then 35, you again see the differences between the 40-watt and the 100-watt voltage on the e-cigarette product. So I think a bottom line here is that each of these products may actually carry their own negative health effects depending on the product design as well as multiple variables that I talked about earlier. So in other words, you can't put all of these products all into one category because of they may all vary in the differences between of negative health effects. But again, I think overall, consuming any of these aerosol products can have a negative health effect. It just depends on the degree. So I'm going to run through now and transition a little bit. Let me get a little bit of water here. So I'm going to transition over to the most recent Surgeon General's report specifically on e-cigarettes. And we've been waiting for a while since these products came on the market in 2010, but we had, again, the Surgeon General's been compiling, and the folks at CDC have been compiling information, and this report, scientific report, came out in 2016. And you can see that there were 7 major conclusions to the report, and I'm going to cover those very briefly, and some of them will reinforce the information I've already provided to you. So this is the first bullet point in the conclusion of the report, is that e-cigarettes are rapidly emerging in diversified product class. So I think from what I've described to you thus far about these products, you can clearly see that that is you would draw that same conclusion. That e-cigarette use among youth and young adults has become a major public health concern. Again, the uptake of use among our teens, especially in high school and now filtering down to middle school, young adults, is a real cause for concern, especially looking at youth becoming addicted to nicotine. These are youth that would not be inclined to smoke. But I'll show you a little bit more information as a result of one of the conclusions, that youth who begin with e-cigarettes, who may have not been attracted to use any type of cigarette product or cigarettes, now may be moving forward more attracted to or actually becoming addicted to nicotine and more attracted to using cigarettes. And so we've seen some studies that that progression may be occurring, which is very concerning. So again, e-cigarette use is most commonly used tobacco product among youth, surpassing conventional cigarettes in 2014, and you saw that data earlier that I presented. That holds true in North Carolina as well. And again, e-cigarette use, as I mentioned, is strongly associated with the use of other tobacco products among youth and young adults, including combustible tobacco products. I think there's 9 studies at this point in time showing that conclusion, and we've seen that from other countries as well, where you see youth progressing on to combustible tobacco products that they probably would have not utilized, but having this beginner product, and also beginning to use both dual using by using e-cigarettes and other combustibles. Going back a little bit to our data, again, to reinforce what I shared with you earlier, is that you can see in 2011 there was 1.7% of high school students that were using e-cigarettes, and that jumped up to 16.8% in 2015. And you can see also that the green cigarette use here, you can see that going as a downward trend. But looking at 2015 data, when asked the question about considering use in the next year, up at 27.5% was very alarming. And we, as I mentioned earlier, our youth tobacco survey was just conducted this year among middle and high school students across the state, and we will be having the results, getting those results and publishing those results in the spring of 2018 this year. And we're concerned that we're going to see another increase among middle school and high school use. We actually saw at the national level in 2017, we saw a slight, actually, I should say in 2016, we saw a slight decline from our 2016 data, but that has, unfortunately, that's gone back up, and much of the researchers are contributing that to the new product, the Juul, that I described earlier, which has just been something that has been attracted to youth, and many youth are using that product, which has, again, led to an overall increase among e-cigarette users. So, again, I concluded this, but one of the studies shared that the baseline, that youth were 8.3% times more likely to progress to cigarette smoking after 1 year than non-users of e-cigarettes. The fourth conclusion is that these products contain nicotine, which poses danger to our youth, pregnant women, and also the fetuses. And the use of these products containing nicotine in any form for youth, including e-cigarettes, is unsafe. So let me back up and for 1 second and say that again, nicotine has been shown to have a real negative effect on adolescent brain development. It can lead to, again, easily being distracted, easily being led to the loss of concentration and other types that are reflected in brain development among the adolescents at that time can have a negative effect. So there's been clear research on that we are very concerned about. So the fifth conclusion in the Surgeon General's report is that this aerosol is not harmless, and I think you can, again, you've seen that from the earlier information that I shared with you that reinforces that again, having these toxins within the exposure to the, especially to the respiratory system and the cardiovascular system, and also to the brain, can have a negative effects and can cause harm, especially to youth. And number 6 is that conclusion is that these e-cigarettes are marketed by promoting flavors and through wide ranging media channels. We're having these products are being advertised in places that we haven't seen cigarettes advertised in many years, and kids are being attracted to these products in many different ways. I shared with you a lot of based on the design and also based on the marketing language and also, again, the flavors. And this is the analogy that I will share with you today that you can convey to other folks of what's happening right now is that the marketing and advertising are really driving kids, as an analogy, are driving kids to the water. And the flavors are making them drink. And then the nicotine is then bringing them back. And so that's unfortunately the cycle that we're in right now. And so with the ads, a lot of the traditional marketing and that's been used going all the way back to the 40s and 50s when we had, as you saw from the earlier graph, when we had consumption of cigarettes among almost half the population. The marketing of these products, using celebrities and again, movie stars to promote the products, that's all back now with e-cigarettes. And you can see here that images of actresses and actors that are such as Jenny McCarthy up at the top are promoting e-cigs again, and these are become very attractive to youth, having these types of celebrities promoting the product. So unfortunately, what's old is new again when you look at e-cigarette tactics of marketing. As I mentioned earlier, the flavors are really attracting the youth. 7 out of 10 middle school and high school students currently use tobacco that's a flavored product. And you can see the multi-million dollars sort of going into marketing these products. This is old data at this point in time, back from 2014, National Youth Tobacco Survey, and looking at overall estimates of youth that are exposed at the retail level, which again, $14.4 million of marketing going there. Exposure through the internet, which is huge, 10.5 million and growing. All of these are growing. Television ads for e-cigarettes. We haven't seen, again, as I mentioned earlier, we haven't seen cigarettes advertised on TV in decades, and now we're seeing e-cigarette ads promoting on TV. And of course, then magazines, especially those magazines that have a high readership among youth and young adults, where we see heavily marketed e-cigarette ads. So a lot has been discussed about e-cigarettes and their potential to reduce harm, and this has been a debate and continues to be a debate in public health field, and I'm sure in substance abuse prevention, where you look specifically at tactics of harm reduction or strategies that are for harm reduction that can, again, result in people moving from one product that may have more of a negative health effect to a product that has less risk to it. And this has been a big debate, especially among adults who are cigarette smokers and are addicted to nicotine. And on an individual kind of a theory basis, if we can have a lifetime smoker or individual that's trying to quit, that can stop smoking by utilizing an e-cigarette product, which potentially has lower risk because we're not getting all the combustible tars that are from and other chemicals from the combustion process. Maybe there's a reduction in risk. However, I think that CDC lays this out really well on a continuum, is that we have to identify if this is a risk reduction product, then we have to identify what kind of risk that it is having, and not only from an individual health perspective, but across the population. And this is one thing that CDC has looked at, is that how is this product leading to initiation of combustible tobacco use among non-users? Is it considered reducing harm if it's leading to initiation? And we've seen that it does. If it leads to relapse among former smokers, where they actually have become a non-smoker but are now taking up this product, is that considered harm reduction? If it diminishes the chances that a smoker will quit because maybe they are not using nicotine replacement therapy that is FDA approved, or what's been suggested by their physician as a known way of quitting, but they're now using trying to use an e-cigarette product, but more likely that they're dual using e-cigarettes and cigarettes. What about if it discourages, again, users from using or smokers from using proven quit methods? What about if it exposes children and pregnant women and non-users to secondhand aerosol? It glamorizes or renormalizes tobacco use, and it also results in poisoning. So I think all of those variables have to be taken into consideration for this to be considered a harm reduction product. So again, as I mentioned, that majority of adult e-cigarette users are also using conventional cigarettes. We've seen up to 80% of majority of adults who are trying to quit maybe conventional cigarettes that are using the e-cigarettes maybe as a quit mechanism, but they're actually dual using both. What we've also seen, unfortunately, is that e-cigarettes and poisoning, and you may have heard about this in your communities, where the e-liquids in the past, and when they first came on the market, they were not regulated in any way, and so therefore the small bottles that contain nicotine, which is very poisonous, nicotine can actually, even a tablespoon, has the effect can be deadly for a person of 150 to 200 pounds. So for children, it only takes a small amount of these e-liquids that can have devastating health effects, and it can lead to death through poisoning. And so when these, as I mentioned earlier, when these e-liquid containers first came on the market, there were no child resistant packaging with the containers. And so what we had is that consumers buying these e-liquid solutions to buy as to refill their liquid containers, children were often getting their hands on these liquid bottles, easily opening them up by just unscrewing them, and then many times smelling of the liquid and having that fruity flavor. So kids are feeling that these were, just basically candy, and often consuming some of the e-liquid. So you can see the escalation increase in calls to the poison control centers across the country. And the same holds true for the Carolinas Poison Control Center. We've seen the same increase among poisoning calls related to e-cigarettes, again, have really skyrocketed. Fortunately for us, and it also at the national level, there was a bill that was put in place here in North Carolina just a few years ago that was led by the Child Fatality Task Force and Senator Stan Bingham, that again regulated the e-cigarette liquid bottles, that they have to come in child-resistant packaging. They also have to state if they have nicotine content in them. So we're hopefully going to see this trend line hopefully reverse itself, or at least be on a downward line over the next few years as these products get marketed or regulated at the state level as well as at the national level. Unfortunately, the other thing we've seen with these products is that in many of the products, the way they're designed with the batteries, lithium batteries, that they can explode. We've seen these with other products on the market, such as cell phones and hoverboards, but this is something we're finding with this electronic product. And here you can see the devastating effects that these products can have from explosions and fires. We've seen these explode as people are inhaling on them, and we've also seen them explode when people just have them in their pocket, which can cause pretty devastating burns to someone's legs or limbs. The UNC Burn Center, again at Chapel Hill, has seen a major increase in treating victims of explosions and fires. This is an example, and we have this in a video on our website. This is an example of a gentleman that's walking into the Cumberland County Courthouse that was caught on a remote videotape. And so he's just beginning to get on the elevator, and if you look at the video on our website, you can see how this thing explodes like fireworks. It goes off in his hand, caused a lot of tissue damage to and burns to his hand and his arm. But this is again an example of how these can be and can have negative health effects by just exploding. And so I think there's going to be, again, FDA is looking at regulation of these products and how they're designed to avoid them exploding. So again, I think all of those factors need to be taken into consideration in regard to, are these products really a harm reduction product? So the last conclusion is that, from the Surgeon General report, is that we really need to take action at the national, state, local level to really regulate these products. Again, incorporating e-cigarettes into smoke-free policies, preventing access to e-cigs by youth, looking at price and tax policies, looking at retail licensure of the products, looking at regulation of e-cigarette marketing likely to attract youth, and educational initiatives targeting youth and young adults. So there was really a call to action here. So as I mentioned earlier, there was an attempt of regulation of e-cigarette products by the FDA, but the bottom line is that the federal courts, as you see in Bullet 3, rules that e-cigarettes cannot be regulated as a drug or drug delivery device, but FDA does have the authority to regulate e-cigarettes as a tobacco product. However, I will mention that any e-cigarette company can bring their product to the market as a cessation device if it goes through the proper channels at FDA and gets cleared and promoted as a cessation device. Thus far, there's no products that have gone through that clinical trial process to be introduced to the market as an official FDA-approved cessation device. And therefore, there shouldn't be any claims that these products can help people quit smoking, when in fact there's no scientific research that shows that's clearly the case. So, as mentioned through the courts, that FDA does have the authority to regulate these products as a tobacco product. And so, as you recall, in 2009, Congress and President Obama, Congress passed and President Obama signed this, the Family Smoking Prevention and Tobacco Control Act, which gave FDA authority to regulate specifically cigarettes, cigarette tobacco, roll-your-own tobacco, smokeless tobacco, and then the category that e-cigarettes fits into, and cigars also fits into this category, and other emerging products. Hookah also fits into this, as any other tobacco products that the agency, by regulation, deems to be subject to the law. And so in 2015, after the whole regulatory process and rulemaking process, FDA put forth a new rule that became effective in August 2016, where FDA now has the authority to regulate electronic cigarettes are all ends products, including all parts, components, and but not necessarily some of the accessories like some of the chargers, or bags and things of that nature that they may be contained in cases. So the e-liquids are being regulated. Hookah tobacco, water pipes are now under authority by FDA to be regulated. Cigars are also in that category, pipes, and then certain dissolvable nicotine delivery products as well. So this was just in effect as of August 2016 that FDA gained the authority, so not too long ago. So the rule includes a lot of the provisions that have already been put into place about prohibiting sales to children. And of course, we, through the Division of Mental Health, our state has a contract with FDA to prohibit sales of tobacco products to youth, including e-cigarettes. And we also the FDA restricts vending machines to adult-only facilities, and we also have a law that restricts vending machines here in our state as well, and also to prohibit free sampling. That's also in effect now. Here are some of the other provisions that FDA is in the process of regulating. I would still call it the Wild Wild West because it takes quite a period of time to get regulations in place. But FDA will be pursuing registering and having manufacturing establishments providing product listings to the FDA of all their products and the contents, all the ingredients, any harmful and potentially harmful constituents, which also have to be identified to FDA. Again, the responsibility is on the manufacturer and the vendor to provide that data. Requiring pre-market review and authorization by FDA. That's a requirement that the new administration through FDA has recently pushed out to 2021-22. And we'll see as over the coming years of how these products have to go through a authorization process to actually stay on the market. Placing the health warnings on the products and advertisements is also on the docket for FDA to put into effect. And then not marketing any newly deemed tobacco products, including e-cigarettes, with any modified risk claims unless authorized by FDA. In other words, if these products are promoting themselves as less harmful or as a cessation device or in any way promoting any kind of modified risk claim, that cannot be put on the packaging or marketing unless it's been verified by FDA, and that's a process that FDA will be going through over the next few years with all of these products. Unfortunately, FDA, the rule, but I think this is something that FDA will still be taking up, is looking at the flavors. As you know, flavors have been banned in cigarettes and by FDA, but the FDA did not take initiative in this early on ruling to ban flavors that appeal to youth. I think that's still a big, huge push that the public health is pushing for, and this will be addressed hopefully at FDA in the future. Also, looking at the marketing that appeals to youth, to kids, was not addressed in this rule either. Only marketing as it relates to any types of false advertising or non-verified advertising, making claims. So let's talk a little bit about what's happening here at the state level. Again, as I mentioned, the evidence is very clear that we need to protect our clean indoor air standards, and so as CDC has pointed out here, that clean air free of smoke and any kind of electronic nicotine delivery system aerosol, we need to protect the health of bystanders, prevent tobacco use initiation among youth, right, having that positive norm that these products are not being widely used, and encouraging complete smoking cessation. So now we're seeing a lot of these signs going up, that there's non-smoking. I'm sure you're seeing these a lot of the places where you visit or in your workplaces, where we're working with, again, at the county level, the city level, and also looking at the state level to include e-cigarettes and really have a policy that includes all nicotine delivery products. So you're seeing new signage such as we have illustrated here. Here's a list of more recently, and I think this actually needs to be updated slightly because we've had a few other cities recently adopt new ordinances, and where you have the list of counties and municipalities that specifically passed ordinances to prohibit e-cigarettes and add on to their smoke-free or tobacco-free policy. Specifically a clause that makes it very clear that e-cigarettes are prohibited, mainly in the government buildings, as well as often on the government grounds as well, including parks. So here's a long laundry list, and again, you can see if your county or the city of which you reside or work in is on this list or not. I think again, you all can be strong advocates, again, based on the health information that you've gotten today, to educate decision makers to reduce not only exposure for non-users, but also set a positive norm that's free of all nicotine delivery products in these types of settings. If we move on and look at a few other laws, let me just point to the third one on the bullet, the child-resistant packaging law that requires child-resistant packaging, as I mentioned earlier, has gone into effect. And we're, again, as I mentioned, we're hoping that's going to have a positive impact on reducing the poisonings that we've seen across our states, especially for youth. And as I don't think I failed to mention earlier, there has been one death as a result of this in New York, but again, we've seen major illnesses within kids and seizures and those types of things as an effect of kids getting their hands on these e-liquid containers and consuming the content. So that's one thing that, again, a law that's gone into effect here, which is really, again, has strong support. It did get unanimous support from all House members and Senate members. Going back to the top, youth access, our state law prohibits e-cigarette sales to minors, and we're working very closely with our partners in substance abuse prevention as it relates to enforcing that law and working with, again, alcohol law enforcement and other local law enforcement. Public schools went tobacco-free, as I mentioned earlier at the beginning of the slide, back in 2008. And, of course, when these e-cigarette products were not even anywhere on the radar screen. And so e-cigarettes have been identified in state law under the Youth Access to Tobacco Law as a tobacco product. Also, under the state excise tax are also defined as a tobacco product. And, therefore, our tobacco-free schools includes all tobacco products, and this is just another generation of those of a tobacco product, and they are prohibited on campus. Unfortunately, we're seeing again uptake of the e-cig products, especially products that can be easily concealed, like the Juul, and where often teachers don't even realize that it is a tobacco product that's prohibited on campus. They think, again, it's just a flash drive, and so. This is something that we're working very closely with our Department of Public Instruction on, and working with local schools around the state to make sure that often not only teachers but also parents know what these products look like and the health risk of these products and the dangers of them, and also making sure it's clearly communicated that these products are not allowed anytime on campus by anyone. And then the excise tax, North Carolina did place a small excise tax on e-cigarettes back just a few years ago, and this was an excise tax that was actually recommended at a legislative tax committee by one of the tobacco companies. And the thought was that they wanted to actually tax the product at a very low tax rate, and so that legislators would not address this at wanting to tax it at a higher level down the road. So Thus far, we haven't seen any other attempts to tax this product any higher than what was actually recommended and approved at that time. Other states are also looking at taxing e-cigarettes the same way they do cigarettes or other tobacco products, rather than having a smaller tax based on the liquid content at a very low level, 5 cents per milliliter. So I think one concluding statement is that the rationale to regulate e-cigarettes is really clear, and I think it's important that they not be treated differently. That we really want to make sure that we don't send the message that acceptance of addiction, as you all clearly know, with nicotine delivery products is there, and therefore complicating the health message so that we're defining one product as potentially less addictive than another, and we haven't seen any research that clearly shows that. So permitting e-cigarettes encourages dual use, cigarettes and e-cigarettes in lieu of cessation among some individuals who might otherwise quit. Again, it exposes children, adolescents, pregnant women to nicotine and other toxins and e-cigarette aerosol. So again, and creates a potential confusion regarding rules and mixed messages. So one question that often comes up is, does our state smoke-free restaurant and bar law cover e-cigarettes? And the answer to that currently is no. Again, as I mentioned earlier, that law went into effect January 2010, and it was really before these products had any kind of widespread use, any kind of electronic cigarette had a widespread use. There had been discussions about e-cigarettes being added to the law. That's up for future discussion. Right now, it is very clear that any restaurant or bar owner has the clear authority to prohibit these products in their establishment, and many of them, I think up to 50% or more of restaurants have been identified through a small sample study that they're already prohibiting those products. They don't want to have them confused with that they're allowing smoking, since especially some of the products look very similar in design, and also people and consumers and workers are now, it's more of a norm that we have clean air in those establishments, so introducing another product that can add aerosol and toxins into the environment is not something that's being supported. So, but local governments have the clear authority to regulate e-cigarettes in obviously their government buildings, but also in public places such as restaurants. And Dare County, for example, has a Board of Health has already prohibited e-cigarette use in all restaurants in their county. And I think you'll see more counties moving in that direction. So there is clear authority at the local level. So the 2017 legislative update, just very quickly, is that there was a bill introduced, House Bill 276, that had bipartisan support to raise the level of funding back up to the level of which existed when the Health and Wellness Trust Fund was focusing on youth tobacco prevention. That bill went through the legislative process and through the budgetary appropriations process, and the final budget had $500,000 for the 17-18 fiscal year, and also $500,000 non-recurring in 18-19 fiscal year. So we have been really working on getting those funds allocated out, a small amount of allocated out through our regions, through health departments who are working with partners and schools and communities and youth to really start with education. And I think the main education we're doing right now is with adult influences of youth, and making sure with a lot of the information that I've shared with you today can be conveyed, and also policies can be better communicated and also put into place. We're also contracting with an agency to conduct youth empowerment trainings, and also for adult trainings to work effectively with youth to effectively get messages out. We're doing focus groups with youth as it relates to effective educational messages related to these products. And also we're putting money into evaluation, and so that all the efforts this year can be soundly evaluated and can lead to improvements for next year, as well as hopefully, as I mentioned, these are non-recurring dollars, so hopefully as we move forward we can not only increase the amount of funding, but also, again, have wider spread educational efforts on these products. Quitline NC also received $250,000 in additional funds this year to promote the Quitline. And again, the budget picture, we're just getting some information of what the budget may look like for next year, and we'll be tracking that and monitoring that along the way. I will say that there are partner agencies such as the North Carolina Alliance for Health that have been identified as the need for increasing and strengthening youth prevention dollars, as well as also strengthening Quitline dollars based on the need within our state. So let me just summarize real quickly, and then I'll share just a few resources, and then we can go to some questions. Again, as you've heard some of these, just to reinforce some of these points, is e-cigarettes are now the most commonly used tobacco product among U.S. youth. Youth use of tobacco products in any form, including e-cigarettes, is unsafe, and that's very clear that there's this misperception among youth that they are a safe product. They're just basically flavored water vapor. We've got to turn that around. That message is costing us a lot of unfortunately youth that are now initiating e-cigarette use for the first time. And based on current findings, researchers believe e-cigarette use could increase users' risk, especially of oral cancer and other types of cancers, specifically respiratory, as you saw with our early on studies of looking at the not only the deadly effects on the cells, but also the inflammation that's being studied. That's also a trigger for disease. So e-cigarettes are not currently an FDA-approved quit aid. We covered that, and at this point in time, there's no products that have been approved by FDA, electronic cigarette products that are out there that have been approved in that manner and through those channels of approval. And then the landscape continues to really diversify. I mean, the Juul just came on, as I mentioned earlier, just came on the market just a couple of years ago, and has just really skyrocketed among use among youth, given its high-tech design, sleek design, delivering a high amount of nicotine to the user, can be easily concealed. We've heard a lot from schools saying that actually students can easily use these even in a classroom setting and not be identified. And then there's multiple different stakeholders that I think we can take action. You all are very, within your positions, can be a real strong voice to lend to reduce the public health risk from exposure to tobacco use and e-cigarette use. So I'm hoping that you're going to take this information today and share it with your colleagues and share it with the stakeholders that you work with to make sure that we can, again, reach out, especially to those adult influencers who have the information that can then have a positive effect on our youth. I will close with a few resources. The Surgeon General's report has an excellent, the one on e-cigarettes has an excellent website. This one's tailored for youth about knowing the risk, getting the facts and know the risk and take action. So there's some great resources on this website at surgeongeneral.gov. It's actually e-cigarettes.surgeongeneral.gov but you can also easily Google Surgeon General's report on e-cigs, and all this information, this website can easily be found. I'm not going to talk about this product very much on the market right now, but here's another product that we will be talking about in the short term that's being test marketed right now, and this is on the horizon. It's called a heat not burn product, this is in a similar design. It actually mimics a cigarette and also mimics an e-cigarette, but really what happens is that the cigarette is actually heated and doesn't burn. It's not combusted, but it has enough of a heating mechanism in it through the battery power to heat the tobacco itself up, which creates a heat stick, in other words, and delivers and basically an aerosol that comes into the user. So it doesn't contain a liquid format. It contains actually the tobacco cigarette itself, which can extract the aerosol. And again, this is important to know that this is being test marketed right now by Philip Morris, and RJR has a similar type of product, and as you see here, and this is a product that we may hear more about in the future, again, looking at a product that may be marketed in some way as a harm reduction product, but again, it may be delivering in just a different mechanism the same toxins to the body. Let me mention that very quickly that here are our regional managers, tobacco control. Hopefully that many of you have reached out to folks in these regions and are already working with these folks on tobacco control. If you haven't, I would strongly encourage you to get in touch with the person that oversees the region that you're located in, the county that you're working within, to reach out and see what work together with them on this effort at the local and the regional level. So you'll have this map and you can refer back to it, but here are the names, the phone numbers and email addresses of these folks. And I strongly encourage you, again, if you haven't already, to get in touch with our regional managers, and we need to all be working together on this effort. And there's information on the folks here. Here's my information, as well as our staff, programmatic staff that's working at the branch level. So questions. So I will open it up, and Terry, if you have questions that you want to specifically that may have come in through the Q&A that you want to read out to me, I'll be glad to look at those and answer in the last 4 or 5 minutes we have left. Any questions?
Actually, I'm not seeing any additional questions
okay.
in the chat box. I really think you covered everything. If there are any questions, by all means, if someone would like to unmute their phone and ask a question, we can wait a minute for that to happen. If not, we'll just wait a couple minutes. But please remember that you know, Jim Martin is very available via email, just bringing a wealth of knowledge, and this was excellent for us to hear what's going on. I am seeing one question. And is there a talking points one-page version of this so that they can use with local policymakers?
Yeah, I would direct you to 2 things. One is the Surgeon General's report. There's some really good information and fact sheets that have been tailored for health professionals as well as parents that can also be utilized with youth. And I would also direct you to our website. You can easily Google Tobacco Prevention and Control Branch. Go to our site, and we have just recently published several one-pagers specifically on nicotine and nicotine delivery as it relates to the health risks to youth. I would encourage you to go to both those sites. Also on our website, go to our tab on e-cigarettes, and there's also some information that you can easily gather that's in a really digestible format that you can provide to decision makers.
Any new policy recommendations for this year?
So we're going to continue working with our schools on the policy. As I mentioned, e-cigarettes and all tobacco products are included in tobacco-free school policy, but there is challenging efforts with enforcement of that and communication of that policy. So we're working very closely with the schools. We'd like to see new signage go up in all of the schools. As some of you may remember from work with the Health and Wellness Trust Fund, we were able to provide schools with signage that included, at that time, signage including all tobacco products, but mainly focusing on cigarettes and smokeless tobacco and other combustibles. But now in the age of e-cigarettes, we need to make sure that those products are clearly communicated, that they're prohibited on campus. So we're working with schools on compliance issues. We're working with local communities on making sure that towns and cities identify the health risk of individuals using e-cigarettes in government buildings. We've had a lot of complaints with people using e-cigarettes, and for example, in government libraries and places like that. So policies to be put into place more at the local level. Also at the local level with our behavioral health facilities, I think it's very important that we move toward, as the state has set as an example, to move toward tobacco-free property and campuses, and put the emphasis on treating nicotine addiction through evidence-based treatment programs and recovery programs. Those are really, really important as well. So we are also working very closely with multi-unit housing. There's a new HUD rule going into place for public housing that makes all of the facilities and residences smoke-free, and this is fantastic. We were also encouraging that those facilities also include e-cigarettes as well, so that we're also reducing children's exposure to e-cigarette aerosol. Other questions? Those are good. And if you can't find something, let me go back to the resources earlier. If you can't find something on our website and you're still trying to look for exactly the right resource, just send me, let me go back and you can make sure you have my, I'll go back one slide so you make sure you have my email address and phone number, but give me a call and we'll definitely direct you to the right resource that you need for specifically a stakeholder. I would also encourage you, if you have a group that you would like a presentation, reach out to me or reach out to one of the regional coordinators. We'll be glad to come out and give, you know, again, we had a 2-hour webinar here. We can condense this information down into, 30 minutes or an hour or so and really try to work with educating stakeholders and other professionals. We all really need to, this is a area where it's being diversified and expanding as we speak, and so we've got to really keep on top of this. And so education for us as professionals is really, really important. So we'll be glad to come out and help in any way we can and work together with you all on this. Well, I guess hearing or seeing no other questions, again, I wanted to thank you for allowing me to and inviting me to speak today on this webinar. It's been great to share this information with you, and I look forward to having you all follow up with our regional folks, as well as if you want to follow back up with me, and we can talk about next steps within your community or within your in your setting, or with the prevention messages that you're trying to work on. And again, I think hopefully we can, again, work together with some of the small amount of money that we've been given out to the regions, work collaboratively together to have as much synergy around this issue as possible. So thank you again, and thanks, Terry, for inviting me to be on.
No, we greatly appreciate it. Thank you guys so much. I'm looking forward to some great work that we can do in the future. Just as a reminder, as soon as you log off, there will be a survey that pops up. Please take that. That helps us with our certification requirement for these hours, as well as helps us improve as we go towards the future. But thanks so much, and I hope everyone has a great day, and I'm sure I'll see several of you tomorrow at the planning and prioritization training.
Thanks very much.